Hello, everyone. Keith Miller here with Keith Miller Insurance. It is early in February. Got January kind of out of the way, but it just seems like already for January and February, there's been a lot of people call asking questions about Medicare. Maybe they're turning 65, maybe they're retiring, but they're aging in or moving in to the Medicare program, and they have a lot of questions and are not sure exactly what to do, what options they have, when they do this or when they should do that. So I decided this year I was going to put together simply what I call a Medicare 101 presentation, just a simple PowerPoint presentation that I can walk you through the steps and the things that take place when you move into Medicare. Now, this can be a refresher course for those of you already on Medicare, but this can also be if you're thinking about, again, going into the Medicare program or needing to move into that, retirement, those type of things. This can be a good start for you to get the conversation started. This is in no ways meant to replace you and I having that face-to-face conversation, getting those questions answered. This is only a precursor, I guess you could say, to kind of getting you thinking about things and how they work and what you need to be thinking. We will ask you to, as we always do, to like and share the video. If, as you know, here on Facebook, when you share things, other people get to see it. So share it with your family and friends. But you can also save posts, as you know, on Facebook. So you can always save it for later. And then maybe you need to send it to somebody that has questions. At the end of the presentation, of course, we'll have all my contact information. I'm always here to help and glad to do that. So let's jump right in. I'm going to do a screen share, hopefully, if everything goes according to plan. And then we're going to be able to let you see everything that we see so we can take you through this and see if we can help you with that. So let's start the PowerPoint from the beginning. There we go. All right. Well, just my logo there. Not a lot we need to say about that. Also, as I mentioned, we are in our Medicare 101 presentation, so we'll just move past that. Good picture of me, I guess you could say. About all we got to work with is what you see, so we hope it's good enough for that sitting there in the office. I've been a licensed insurance agent for 31 years. I've been helping people in the insurance market for 31 years. I wanted to give you a little background on me. Maybe you're new, maybe you don't know who Keith Miller is, and I think it's important you know who your agent is. I live in the great city of Owenston, Kentucky, and that's where my office is in my home there. I again have been licensed for 31 years. I'm an ordained minister as well in the Christian church. I don't currently have a church that I serve full time. I'm kind of in a, I guess you'd say, in a pulpit supply position. I do a lot of fill in for churches in Kentucky and Indiana specifically, and help churches when maybe their minister's away or maybe they're without a minister. I do some short-term interims, whatever's needed there. Works really well right along with my insurance business. A lot of the churches that I tend to help can't afford to have a full-time minister or can't afford to do a lot of things as far as benefits and such. And so the insurance business has provided and been a blessing to be able to help churches as they move through their ministry. So, ordained minister, licensed 31 years. Should have put this at the top. Been married just recently, 49 years, to my wife, Pam. Our anniversary was January the 28th, and we got married in 1977 when all the snow was going on. But we have been married 49 years and already making plans of what's going to take place on the big 5-0. So, real excited about that. Pam has been a big help in my insurance business from day one. She is kind of behind the scenes. She pushes some paper, makes some calls, sets appointments, those type of things. Hobbies, well, I enjoy woodworking. I really do. I always have enjoyed woodworking, and Pam likes to travel. So I guess you'd say my hobbies are woodworking and traveling with Pam. As I say there, we do some camping. We have a camper. We like that. I enjoy being around people. I'm a real people person. Um, I enjoy having good conversations and helping folks when I can. And we are very service minded here at Keith Miller Insurance. We have people all the time saying, I can't believe how quick you got back to me. I can't believe you answered the phone when I called, which I don't understand that because when you're in business, people call, you're supposed to answer the phone. but people are sometimes amazed by that. Active license. I have active license in Kentucky, Indiana, and Ohio. And as I said, I've been licensed for 31 years. Just some comments from people there. Nothing you have to really look at. Folks give me some good reviews and reviews on Google and some of that. So let's talk about the original Medicare plan right out of the gate. Original Medicare is run by the federal government. You're going to see me read through some of this, and I'll interject some thoughts as we go through. Original Medicare started in 1965. People began to enroll in Original Medicare in June of 66. They tell us that it's something over 10,000 people a day are turning 65 and will, over the next 12 or 15 years, be joining the Medicare program. President Harry Truman fought for the creation of a national health insurance fund, Medicare. He started that fight in 1945. President Truman did. Medicare was signed into law in 1965 by President Lyndon Johnson. And the first person to enroll in Medicare was, there you see, President Harry Truman's and President Johnson signing the bill. Now, if you're currently in the Medicare program, and we'll talk a little more about that when we get to it, you know that your Medicare Part B premium for 2026 is 202.90, $202.90. But if you'll look down here on this actual card, the application for enrollment into the medical insurance program under the Social Security Act, Medicare, you'll see that President Harry Truman, Lyndon Johnson, and right here, you'll see that Harry Truman's cost, it says your share of the cost, $3, will be deducted from your monthly Social Security benefits. So back there in 1965, when it came into law, President Truman, along with everyone else, was only paying $3 a month, and today we're at 202.90. I guess you'd say definitely inflation, right? All right, who's eligible for Medicare? Well, original Medicare Parts A and B is kind of what we're talking about. You have to be 65-year old. You have to be a U.S. citizen and a resident for at least 5 consecutive years. Now, there are instances where you can enroll in Medicare under the age of 65. If you're on Social Security disability, and maybe you have end-stage renal disease, kidney failure, or Lou Gehrig's disease, ALS, then there are some exceptions to it. But most people enroll in Medicare when they're age 65 or older. But I have and do have some folks who are under 65 who are enrolled in the Social Security and Medicare program due to a disability. So there are some exceptions to that. Parts A and B, when can I first enroll? Well, your initial enrollment period, we call it your open enrollment period, is 3 months before your 65th birthday, the month of your birthday, and 3 months after that. And enrollment in Part A is automatic if you're already receiving Social Security benefits. So they will actually back that up to then. Your initial enrollment period is a 7-month window. What if I'm late enrolling? For Part A, usually there's no penalties unless you didn't pay enough into Social Security. But Part B premiums can be higher if you miss that initial enrollment period unless you qualify for an exception. Now, I think we're going to address it when we get over in there, but let's talk about the elephant in the room. Do I have to sign up for Medicare when I turn 65? The answer is yes and no. Let's start with no. No, you don't have to if you're going to continue to work and you work at a place that has 20 or more employees and you're on that employer's group plan of insurance, you or your spouse. Again, if you are going to continue to work past the age of 65 and you work for an employer that provides to you or your spouse group health insurance, and that employer has 20 or more employees, then you can delay enrolling in Medicare until you get ready to retire. There is that cost of 202.90 as we mentioned for Part B. Part A, there is no cost. You could go ahead and enroll in that, and then you would pick up Part B when you get ready to retire. But you have to make sure that you work for a place that has at least 20 employees, and you're on their group coverage, or maybe you're on your spouse's coverage at work that has 20 or more employees. Medicare, Social Security considers that what we call credible coverage, and with that, you would not have any late enrollment penalties as long as you work for a place, 20 more employees, and you're on the group coverage, you or your spouse. So you can delay coverage. I do have people call me and they'll say, Keith, I was told I have to sign up. Well, it depends on your situation. Let's say you're aging into Medicare, you're turning 65. And for a couple instances, maybe you have your own individual plan that you've purchased off of the marketplace. Or maybe you work for a place that doesn't have 20 or more employees. Then, yes, you need to go ahead and sign up for Medicare when you're first eligible at age 65. Because without credible coverage, if you delay signing up for Medicare, then the penalty for a Part B premium delay is 10% per year for every year that you don't have it. I know that sounds a little complicated. Hopefully that helps some, but you can always reach back out to me with a question if we need to clarify it again. But the worst thing that sometimes people do, they get some bad advice, and the bad advice is, oh, yes, you have to sign up for Medicare. Well, they sign up for Medicare, they continue to work, they're on their group coverage at work, they have 20 or more employees. So what happens is their group coverage is primary, Medicare becomes secondary, and they're paying their Medicare Part B premium and getting absolutely no benefit. So if that is as clear as mud, then we can talk one on one about that. But when you're first turning 65, you have to make some decisions about that so that you're not penalized. As I said there on the bottom of the screen, the penalty for not having Part B is 10% per year that you go without Part B Medicare and if you have no credible coverage. What if I work past age 65? We just talked about that. You can enroll in Part A and Part B. You keep records. Their special enrollment period comes in. We just went over that. So, what is the original Medicare program? People will ask me, what is Part A, Keith? I know Part B is like 80/20, but what is Part A? Part A is the hospital side. If you get your red, white, and blue Medicare card, you're going to see an effective date for Part A. You're going to see an effective date for Part B. In many, many cases, those are both the same. However, in our previous scenario, let's say at age 65, you went on and signed up for Part A. There's no cost for Part A, so there's no harm, no foul. So you sign up for Part A, but maybe you wait and pick up Part B later. So Part A is the hospital side of Medicare. Okay. Part A covers inpatient hospital care. It covers inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. I always share with people about the hospital side because I think, as I started to say a while ago when I got sidetracked, a lot of times they'll call up and say, Keith, I need something to take care of the 20% that Medicare doesn't pay. Well, the 80/20 side comes in for Part B. And I usually say, well, what about the hospital side? And they almost all say the same thing. Oh, Medicare pays all my hospital, right? No, there's some major cost there. We'll show you that in just a moment. But just always remember, hospital Part A is for the hospital. Basically, it's inpatient care is basically what that is. The cost for this year for Part A Medicare, if you're in the hospital, these numbers I'm going to show you in the next couple screens. If you have nothing but Medicare A and B, if you don't have Medicare Advantage, if you don't have a Medicare supplement, Medigap plan, these are what the cost would be. I show this because there is a segment of our population who really can't afford anything or don't want anything but original Medicare Part A and Part B. This is the Part A side. This is the hospital side. For instance, if you go in the hospital and you're in there one day up to 60 days, Medicare will pay all of your hospital bill, but you do have a $1,736 deductible. If you're in the hospital one day and all you have is original Medicare, if you're in there one day, you're going to pay 1736. If you're in there 3 days, you're only going to pay 1736. They're going to pay everything else. But let's say you're in there 60 days. Well, you still only pay 1736. Couple scenarios though. Let's say you're in the hospital and you're in there for 3 days and you're out. If you go back before a 60-day window comes, you do not have to pay that 1736 again. But let's say, for instance, you're in the hospital for 3 or 4 days and you get out of the hospital and a 60-day window passes and you have to go back, you have to pay the 1736 again. That is a 60-day benefit. If it's broke by 60 days, then you have to go back again. Then you would have to pay that. If you're still in the hospital, day 61 through 90, it changes from a deductible now and it goes to a $434 per day copay. If all you have is original Medicare and you're in the hospital day 61 through 90, Medicare will pay for everything else, but you are responsible for $434 per day. Days 91 through 150, your cost $868 per day. And if you're in the hospital 150 days or longer, you pay 100%. As far as skilled nursing goes, skilled nursing facility, you had a surgery and they're going to send you over to some rehab, or maybe you need skilled nursing. Days 1 through 20, you have no copay. Original Medicare takes care of the first 20 days. However, beginning at days 21 through 100, you are responsible for $217 per day copay for that group of 80 days, days 21 through 100. And you're also responsible for the first 3 pints of blood under Medicare Part A. Original Medicare program Part B. Part B is the medical side. That's what we call Part B. It's the medical side. Basically, it's everything else except inpatient hospital, hospice, skilled nursing, rehab, those things. This is everything that's done away from a hospital inpatient setting. Physician services fall under Part B. Physician, primary care, specialist, outpatient hospital services, ambulance, air care, outpatient mental health, laboratory services, durable medical equipment, things like wheelchairs, oxygen, outpatient physical therapy, occupational therapy, speech therapy, some preventative care. Basically, anything that happens outside of an inpatient hospital gets billed under Medicare Part B as in boy. So, if all you have is original Medicare Part A and B, and you need some medical services for 2026, the premium from Medicare Part B for most people, unless you're a high income earner, for most people is $202.90 per month. And if you're drawing Social Security, they will deduct that from your Social Security check. If you have delayed drawing Social Security until later down the road, then they will bill you quarterly for that much per month times 3 months. So 202.90 is the cost for Part B Medicare. Part B Medicare has an annual deductible of $283. That means if you have something done that's billed under Part B Medicare, then you pay the first 283 before Part B Medicare kicks in. Once that happens, Medicare pays 80% after you've met that 283 deductible, and then you pay 20%. So it can add up pretty quick. What's not covered under Medicare Part A and Part B? Under original Medicare, the deductibles, coinsurance, and premiums are not covered. Part B excess charges are not covered. That's the amount that's billed over what Medicare agrees to pay. We'll talk a little more about that shortly. Prescription drug coverage is not covered under original Medicare Part A and B. And additional benefits, things like hearing, dental, vision, are not covered under original Medicare Part B. If you want the services of hearing, of the benefits of hearing and dental and vision, then Medicare Advantage plans have those, or you can pick up standalone dental and vision hearing plans if you decide to go the route of Medigap or Medicare Supplement. So again, we'll talk more about that in just a moment, so you'll know that. So there's two things you can do. People they say, what are my choices? Well, you have two choices. Step one, you're going to enroll in original Medicare when you become eligible, or you're going to delay it, but it all works about the same, whether you do it now or you delay it. So you're going to enroll in original Medicare. The Part A covers hospital stays. The Part B covers doctors and outpatient visits, things like that. So then you have two options after that. Option one is you can keep your original Medicare and you can add to that what's called a Medicare supplement, or as insurance companies call them Medicare supplements. Medicare refers to them as a Medigap plans. They're all the same. So you can have original Medicare and you can add to that a Medicare supplement plan, which covers some or all of the costs that are not covered under original Medicare Part B. Those are always offered by private insurance companies. And you can add to that a standalone Medicare Part D prescription drug plan. So you would have your original Medicare that pays first. You would have your Medicare supplement or Medigap that comes in behind that and pays some or all of the cost of what Medicare doesn't take care of. And then you would have your standalone Part D prescription drug plan that would take care of any prescriptions that might come your way. That's option one. Option two is this: you can choose to go into what's called a Medicare Advantage plan. We'll talk more about those in a moment. You may see those referred to as a Part C plan. With a Medicare Advantage plan, they combine parts of a Medicare A and B. They give you some additional benefits, maybe some hearing, dental, and vision. And most of those plans have the prescription drug part, what we call integrated into that. It's already included into that. Now, when you go into a Medicare Advantage plan, a lot of folks don't realize this, but when you go into a Medicare Advantage plan, you are basically giving up your Medicare rights. Because under a Medicare Advantage plan, and again, we'll have more details in a moment, but under a Medicare Advantage plan, Medicare pays none of your bills. Everything is paid by a private company. That could be any of the major insurers out there, whoever offers a Medicare Advantage plan. You still have to pay your Part B premium this year of 202.90, but you are basically setting aside your Medicare benefits. Medicare pays nothing under a Medicare Advantage plan. So keep in mind, as I said before, keep in mind that if you use Medicare Advantage as your primary insurance, you must still continue to pay your Part B premium, but original Medicare benefits don't get used. They get set aside. Medicare Advantage plan becomes primary. You're basically opting out of Medicare and giving up those rights. So what's the difference between the two? What's the difference? Sometimes folks will ask me, they will say, Keith, I'm not sure which way to go. So that's what we want to do. We want to take just a moment and break it out for you just a little bit. Let's talk about Medicare supplements. What is a Medicare supplement? Well, a Medicare supplement helps cover some of what Medicare Parts A and B don't. As we mentioned before, things like co-insurance, co-payments, deductibles. Medicare supplement plans are offered by private insurance companies. Most all of the major insurance companies out there in the health market offer Medicare supplement plans. They go by different names by letters, A, B, C, D, and such, as you can see on the screen. The benefits vary by plan, and generally, the more comprehensive the coverage, the better coverage you have. Many times, you have the higher premium. Some fast facts. Cost, well, they help pay some of the out-of-pocket costs not paid by Medicare. The premiums vary. They're based on the plan and the insurance carrier. Enrollment, you're guaranteed right to enroll during your open enrollment period. That period we talked about, that from 3 months, your birth month, and 3 months after. However, when it comes to enrolling in a Medigap plan, a Medicare supplement plan like we're talking about here, your enrollment period actually lasts, I should say, 6 months past the date of your Part B or your birthday. So it extends out a little bit farther. But if you miss your open enrollment period, then coverage in a Medigap plan can be denied. It's not something that is guaranteed that you can get into it every year. So you definitely want to consider it, at least give it some thought, at least know how they work so you don't lose the opportunity for that. The thing about a Medicare supplement plan, it goes with you anywhere in the United States. There's no networks. It's guaranteed to continue as long as you pay your premium on time and that you've not made any material misrepresentations on your application or insurance. Let me back up a little bit. When I say it goes with you anywhere in the United States with a Medicare supplement plan, Medicare pays first, the supplement pays after that. As long as that doctor accepts Medicare, then the supplement will pick up the balance that Medicare doesn't pay on any and all approved Medicare services. So it's pretty comprehensive, especially if you travel and those type of things. A little summary about Medicare supplements in general. You have no networks. As I mentioned, you can see any doctor anywhere in the United States that accepts Medicare. You don't have any copays except for Plan N. There's a small copay. We'll talk about that in a moment. You don't have deductibles to meet. There is an exception to that, would be the Medicare Part B deductible. Medicare supplements in general, other than a high deductible plan, does not have a deductible. Your general plans, your Plan G and N, but you do have the $283 Medicare Part B deductible. With the Medicare supplement plan, you don't need referrals. You don't have to get prior authorizations to get services done. You can go to any doctor that accepts Medicare. It can be used anywhere in the US. It has very low out-of-pocket costs. So, in other words, you have a premium each month. After that, everything else is pretty much taken care of. There are some exceptions we could talk about, but it's the most comprehensive way to have health care when it come right down to out-of-pocket costs. Do you have a monthly premium? Yes, you do. But at least you can budget for that and not have the surprises. And it is guaranteed renewable, which simply means every month when you make your payment, it's guaranteed to be renewed to the next month, and then you make a payment and you renew it. You just keep pushing that renewal on down the line. A couple of the most popular plans, Medicare supplement, as we said, Medigap, Plan G. With the Plan G Medicare supplement, you pay the Medicare Part B deductible of 283. After that, you have no copays, you have no networks to deal with, you need no referrals, you have no prior authorizations are needed to get services done. As long as Medicare pays, the supplement's going to pay. It pays any and all excess charges. We'll talk about that in a moment. And it's good at any doctor that accepts Medicare. It is the most comprehensive out there right now. Now, you might be watching this and you might have what's called a Plan F. Plan F is in Frank, we'll say. Plan F is no longer offered to new enrollees. If you came into the Medicare program after January the 1st of 2020, Plan F is not available anymore. Now, there is a certain segment of our population that still has Plan F, but they came into Medicare prior to January the 1st of 2020. After that, Medicare said no more Plan Fs, and that meant Plan G became the most comprehensive plan. So Plan G right now is the most comprehensive plan as far as what it pays. Cost a little higher than the next one we'll talk about, but we'll discuss that when we get to it. Then you have the Plan N, as in Nancy. Plan N operates somewhat the same way, but you're accepting a little bit more of the cost, a little bit more of the liability, shall we say, as we move through that. So with Plan N, you still pay the $283 Medicare Part B deductible. Now, what happens on the supplements, it's like this, whether it's a G or N. When you go to see your doctor and you're brand new to Medicare, the doctor's going to bill Medicare. Medicare is going to look at your file and they're going to determine. If they say, no, you haven't met your deductible yet, they send a note back to the doctor and then you will get a bill from the doctor for that visit. Once you've paid the $283 deductible, Medicare will see that and they will send the doctor his money and then they'll crosswalk, which simply means they'll send the balance of your bill over to your Medicare supplement company, whoever that is. And when that company gets it, they're looking to see if Medicare paid. They're looking for a code. That's all they're looking for. The supplement company is never looking to what you had done. They have to pay the bill as long as Medicare has paid first. So they're looking for the code that specifies that Medicare has paid for that service. And as long as Medicare has paid for that service, then they're legally obligated to pay the balance. So when people ask me, they'll say, Keith, does my Medigap plan, does my Medicare supplement cover this and that and this and that? A lot of times, I will tell them it's very simple. You just ask the doctor, does Medicare pay for this procedure? And that's what I tell them. If you go to see your doctor and he says to me, Keith, this is what we're going to do is kind of new. It's experimental. I've only done a half a dozen or so of them. It's all kind of new. I just kind of say, hold on a minute. Is that paid by Medicare? And they usually say the same thing. Yes, but they don't pay all of it. And my response is all the same, always the same. But that's okay. I don't care. As long as they pay something, my supplement's going to pay the rest of it. So with any one of them, that's how the deductible works. With the Plan E, you pick up a $20 copay for office visit. That's primary care or specialist. Now, the Plan G we had before, we didn't have that, if you remember. There was no copay. It's up to $20 on the Plan N. Up to $20. That means that a doctor cannot charge you more than a $20 copay. I have folks tell me that they pay no copay. A lot of doctors don't charge a copay. I have people tell me that maybe they pay five, six, or seven, and then I've had them tell me I pay a copay every time that I go to the doctor. But with the Plan N, you pick up a $20 copay, up to $20 copay. You also pick up a $50 emergency room copay that you don't have on the Plan G. But the $50 copay for emergency room, they waive that if you're admitted to the hospital. Then and the emergency room visit is covered under Part A expense, which it usually is. But basically, I tell folks if you're admitted to the hospital, you don't have to pay the emergency room copay. So up to this point, you have the same deductible on the N that you had on the G. However, you're assuming some of the responsibility. So you're picking up a $20 copay for office visits. You're picking up a $50 emergency room copay unless you're admitted. After that, you still have no networks. It's good at any doctor, anywhere, any hospital that accepts Medicare. You do not need referrals. You do not need prior authorization to get services done. In other words, you don't have to, your doctor doesn't have to contact your insurance company to see if they're going to pay for whatever he's wanting to do. You just want to make sure that Medicare pays first. And you can usually ask them if it's something kind of strange, but most services are covered by Medicare. So you have no prior authorization. The thing is, the Plan N does not cover excess charges. Plan G covers excess charges. Plan N does not cover excess charges. I'll come back to excess charges. The differences between a G and an N can be anywhere from 25 maybe to 35 to $40 a month cheaper. An N can be cheaper. So you have to decide uh, how many times I'm going to see a doctor a month, how many visits am I going to have to make in a year. You have to weigh the added cost that you're paying out of pocket for the N versus the G and see if that offsets the reduction in the monthly premium. We'll see. Kind of see how it balances out. Excess charges, a lot of folks I talk to, they'll say, Keith, I don't even know what you're talking about. I've talked to two or three different agents. They've never said anything whatsoever about excess charges. What is that? All right. Plan G pays excess charges. Plan N does not pay excess charges. There are two ways a doctor can be involved in the Medicare program. A doctor can take Medicare and be a participating provider, and a doctor can take Medicare and be a non-participating provider, non-par or a par participating provider. If a doctor is in the Medicare program, he accepts Medicare and he is a participating provider. That means he accepts Medicare's payment to him as full payment and he doesn't ask for any more. Okay? He's a participating provider. He's in the Medicare program. He's accepting what Medicare is paying him for your service as full and final payment. Medicare at that point sends, when he bills Medicare, they send him back the money for your service to him in the story. He's a participating provider. If a doctor is a non-participating provider, that means he does accept Medicare. However, he does not accept Medicare as full and final payment. If a doctor does not accept Medicare as full and final payment, then he can bill you separately for 15% of the lesser amount. After Medicare knocks the cost down and everything happens, he can come back and bill you 15%, and that's called an excess charge. Now, that's not a big issue in our country today. Most of the doctors, I think the recent numbers say somewhere between 96 and 98% of doctors and hospitals take Medicare assignment. They take Medicare as full and final payment and they go away. Okay. And whenever Medicare pays them, they're happy with it. They take Medicare assignment. So with 96 to 98% of the doctors accepting Medicare assignment, it's very rare that you'll see an excess charge. It's actually been said that the average excess charge is less than $25. But it is there. That is controlled by Medicare. So you do need to be aware of that. And I share that with every person that I meet with knows what excess charges are. Because if you're going the route of a Medicare supplement plan, the G plan pays those excess charges. The N plan does not pay excess charges. And if you're like me, I don't like surprises too much. So I don't want to be surprised by that. So that's your plan G, that's your plan N and how they work. As I said, the plan N is probably going to be anywhere from $20 to $40 a month cheaper, depending on the company that you're looking at. But again, you do pick up part of the risk, part of the cost there with the copays and the excess charges. Part C, Part C is Medicare Advantage. Um, Both they're the same. Medicare has four parts. Part A, hospital. Part B, medical. Part C, Medicare Advantage. Part D is prescription drugs. We'll talk about that in a minute. Medicare supplement companies, as we all know, we get a lot of calls. Medicare Advantage companies. Let me back up. We all get a lot of calls. They talk to us about Medicare Advantage. In the last little bit, they've gotten a little smarter with that, and now they have gone to asking folks, do you have a Part C plan? I know that happens because people who have Medicare supplements with me will call and say, Keith, do I have Part C Medicare or do I need that? And that is Medicare Advantage. So they are one and the same. Let's jump into that one. Medicare Advantage plans are network plans. They're HMOs, PPO, managed care plans, we call them. They're sold by private insurance companies. Some of the major carriers out there have Medicare Advantage plans that are available to you. Sometimes they look a lot like maybe the coverage that you had at work, those type of things, copays and such. We'll get into that, but that's where they're sold. You can only see doctors in the network. Now, there are some exceptions to that, but very few. But if you're going to use a Medicare Advantage plan, you have to make sure your doctor and hospital is in the network. It used to be that if your doctor was in the network on January the 1st, that he had to stay in the network all year. That has changed. Doctors tend to pop in and out of networks now. So the beginning of every year, if you have a Medicare Advantage plan, during the open enrollment period for Medicare Advantage, which is October 15th to December 7th, you want to make sure that the current Medicare Advantage plan you have, that your doctor and your hospital is in the network. So you have to be careful because if you travel, you can find yourself out of network if you're not careful with that. So it's important that you stay in network unless it's an emergency. Most all these Medicare Advantage companies will cover you if it's an emergency. If something happens, you're on a trip and it's deemed by the doctor, hospital, whoever, the insurance company as an emergency, even though you're out of network, they will take care of that. However, let's say you're one of the snowbirds that sometimes I deal with. Maybe you're in Kentucky 6 months, 3 months, 10 months of the year, but you go to Florida or Arizona somewhere sunny for the rest of the year. You have to remember when you have a place of residence, so to speak, or if you're staying long term in another state, then outside of emergency, you have to be careful because you can possibly find yourself out of network. Most HMOs require referral to see a specialist. Your doctor would, if you needed to see a specialist, he will have to see if there's one in the network that takes your insurance. You will need to have a referral for that. There are more and more HMOs all the time. PPO plans are becoming a thing of the past, it seems, anymore. And all the companies are leaning more and more toward HMOs. Also, you have to have prior authorizations under a Medicare Advantage plan. Maybe not always, but many, many times. I hear the horror stories sometimes of people who are waiting to get things done that need to be done. I've talked to doctors who say it's sometimes very hard to get things prior authorized. You just have to be aware that if a Medicare Advantage plan is something you'd like to have, then prior authorizations are something that you will have to deal with. Premiums can vary from zero to, I think, around $35 a month, depending on the state and the county and the zip code. In other words, if you have a Medicare Advantage plan, more than likely you have a zero monthly premium. And you say, how is that? Well, you have a zero monthly premium, but you're going to have a copay, a deductible, or co-insurance for most everything that you have done at a doctor or hospital. It's kind of the old pay me now or pay me later. We mentioned the Medigap plans. When you have those, you do have a monthly payment, but you normally don't have any other costs after that because after Medicare pays, the Medicare supplement pays. So that goes away. So you have a payment up front, nothing later. With an Advantage plan, you have no payment up front, but as you use it, then you are responsible for percentages, copays, or deductibles as you go through. As I said, plans are usually designed with copays, deductibles, and co-insurance. Plans normally have a maximum out of pocket cap per year. That's a great safety net. What that means is a lot of plans will have a maximum out of pocket. So as you go through the year and as you pay your copays, as you pay your deductibles, as you pay your co-insurance, as you go through the year, if you reach that maximum out of pocket, that can be as low with some plans as $4,000 a year. We have a local company that has a really good Medicare Advantage plan, but the maximum out of pocket is over $9,000, which simply means if you're in that $9,000 max out of pocket plan, that simply means that you could spend in a calendar year up to $9,000. However, whatever that maximum out of pocket, whatever that MOOP is, once you hit that number in a calendar year, then you have no more costs for doctor or hospital service for the remainder of the year. Now that's in network services. Out of network services, if you get hit with those, they don't go toward the MOOP, and your cost for prescription drugs does not go toward the max out of pocket. Plans do provide some extra benefits. You'll see things like vision, dental, hearing. Some plans provide over the counter. Maybe they'll give you a certain amount of money, $50, $100, whatever it might be, every 3 months to buy over the counter items. Some provide meals. I call them meals on wheels. Maybe you're in the hospital or skilled nursing and you come home. Some will bring you in meals. Some companies provide gym memberships. For a few years back, it's kind of gone away, but we had one company local that would buy you a robotic dog if you needed one. If you'd like to have a robotic dog as a source of comfort, they would purchase that for you. If you needed pest care, maybe bugs and things in your home, and you needed care, they could help with that. They did all that stuff, but a lot of those benefits have been really cut back. The Inflation Reduction Act has kind of changed a lot of the benefits that were there before on Medicare Advantage. People comment all the time. I used to get this and I don't get as much, or I don't get it at all. What happened? Well, with the Inflation Reduction Act, these companies, especially the Medicare Advantage companies and the Part D drug companies, are not getting the funding that they used to get to pass that on down, and they've had to cut back on benefits. They've slimmed up the networks. There's not as many available networks anymore. So they're not struggling. I don't like the word struggling, but they are struggling to continue to provide the benefits and the extras that people look forward to and leaned on when it came to Medicare Advantage. So, but they still do provide some benefits. The Part D drug plan is incorporated, as I mentioned earlier, into your Medicare Advantage plan, so you don't have to have a separate standalone prescription drug plan. You don't have to have that. With a Medigap plan, a Medicare supplement plan, you do have to purchase that standalone drug plan. And Medicare does provide a 12-month trial for Medicare Advantage. Most people don't realize that. They're not told that. So if you're brand new to Medicare and you come in at 65 or 70, whenever you retire, if you're brand new to Medicare Part B and you decide that you'd like to try a Medicare Advantage plan, then Medicare says you have a 12-month trial that you can see if you like it or not. Anytime in that first 12 months, if you decide you do not like your Medicare Advantage plan, and it's the first time you've ever been in a Medicare Advantage plan, then Medicare says you can go back, pick up your original Medicare, pick up a Medigap plan, a drug plan, whatever you wish. But in the first 12 months, you can move away from the Medicare Advantage plan into something else if you choose to. However, if you get past 12 months, if you get to month 13, 14, 15, 24, 5 years down, whatever it is, and all at once you decide that you do not like your Medicare Advantage plan anymore, you have to qualify medically to get back to a Medicare supplement plan. There is no open enrollment on Medicare supplement. Once you're in it, there's not an annual enrollment period for Medicare supplement plan. So if you're in a Medicare Advantage plan and you decide that you don't want it anymore and you don't like it, maybe your health has changed, your cost, your out of pocket has gone up, all the stuff that worked well for you a few years back isn't working as well as it is was then as it is now, or then is now as it was then. I'll get it out in a minute. If it's just not working for you, then you have to remember that you have to qualify medically. Now, most of the time, people that are getting some free benefits and have no monthly payments are not looking to move away from that plan until their health goes sour. So you have to be sure that when it comes to Medicare Advantage, that you can live with it long term in a lot of cases. Now there is an open enrollment period every fall, October 15th to December 7th, where you can check and shop around on a Medicare Advantage plan. But if you decide you want to move to a supplemental plan, you do have to qualify medically after the first 12 months. So it's important that you not just think about when it comes to any health care, it doesn't matter what it is, you have to think about down the road. Maybe I'm paying more than I should. Maybe my Medicare supplement rate has continually gone up. But the older we get, the more our health tends to slip away. Um, I tell people all the time, I've been doing this 30 plus years, and I've never seen anyone get healthier the older they get. It just doesn't work that way. So be aware that if you go into a Medicare Advantage plan, you do have a 12-month trial. Anytime in that first 12 months, if you decide you don't like it, you can move out of that and back into original Medicare. Part D drug plans, let's talk real quick about them. They help with the cost of prescription drugs. They're offered through private insurance companies. You still have to pay your Part B premium. Cost, prescription drug coverage varies from plan to plan. Catastrophic coverage protects you from very high costs. Benefits can change every year. Coverage, each plan, let me back up here a minute. Each plan has a list of drugs that's covered. We call that a formulary. You want to make sure that your drugs are covered before you enroll in a plan. And you want to make sure that your list of drugs, you get those checked every year to make sure that the plan that you have covering your Part D prescription drugs, you want to make sure that plan is current, that your meds are covered under that plan. And every year you want to check that. Enrollment coverage is not automatic. You have to sign up for that, and there are penalties for late enrollment when it comes to Part D drugs. Beginning in 2025, there's no longer the donut hole. If you've been in the Medicare program very long, you're familiar with the donut hole. Used to be the donut hole was if you reached a certain level, you fell into the donut hole. While you were in the donut hole, no one paid anything to help you with your meds. You paid full cost until you reached another level. And then once you reached that level, you were out of the donut hole. It was a nightmare. But beginning in 2025, if a Medicare beneficiary reaches a total out of pocket for 2026 of $2,100, if you reach $2,100, then there are no more out of pocket costs on your medications for the remainder of the year. You still have to pay your premium for the remainder of the year. But if your out of pocket cost for your medication reaches $2,100 in a calendar year, for the rest of that year, you pay nothing. You have to be aware, though, that drugs that are not on the plan's formulary do not count toward your out of pocket cost. Also, too, you have to be aware that if your doctor gives you samples, if you use GoodRx, if you use any type of discount card, that does not go toward that $2,100. That $2,100 is made up of all the medications that pass through your Part D prescription drug plan. And you might say to yourself, I'll never reach 2,100. But keep in mind, it's not just what you pay, it's some of the help that you get from your Part D plan and from Medicare in the background working behind that goes to reach that 2100. So I usually sometime I think last year was the first year for this program, and during the year sometimes folks would call and say, Keith, something's wrong. I went to pick up my medications and I don't have any copays. Well, it's because they had hit that number. Last year that number was 2000. This year it's $2,100. You have to be aware too that drug costs can change throughout the year. No guarantee that the copays you pay at the beginning of the year are going to be the same throughout the year. Some folks get a little bit surprised. They'll start out with a copay of $2. Maybe halfway through the year it goes to 5 or 10, and it's because it's like everything else. Costs change, so there's really no guarantee. We do our best here to help folks find the best plan, the most cost-effective plan. I shouldn't say best. We're not supposed to say best. We're supposed to say the most cost-effective. So that's really what it is. We try to make sure that we find you a plan that is the most cost-effective and works for you for the year. Formulary is a list of drugs. You have your tiers, tier 1, 2, 3, 4, 5, and sometimes 6. Tier 1 and 2 are your generics. Tier 3 and 4 are your name brand drugs. 5 and 6 are specialty drugs. That's how the tiers kind of work for there. Questions? Well, I'm sure you're probably going to have some questions. So that's why we're going to put up the old contact info here so you have that. You feel free to call. There's a number on the screen. Email, you can do that as well. I hope this has been beneficial. I know it's taken a little longer than I anticipated that it would. A lot of info in there, and a lot of it, probably a lot of you, are scratching your head and saying, wow, that was so much. I don't know if I understand it all or not. That's okay. Maybe you picked up on enough of it to give you some insight on what to do. We just want you to know we're here to help. We're here to give you direction. We're here to answer any questions, and we'll be glad to help you walk down this path. We've been doing it for a long time with a lot of people, and we feel like we've done a pretty good job of taking care of our folks and making sure they know exactly what's going on and everything. The Medicare market right now is going through some changes. Medicare supplement rates right now are higher than they've ever been. The coverage is great. Every company is experiencing higher than normal rate increases. Medicare Advantage plans, as I mentioned, are cutting back on benefits, skinnying up networks, changing their formularies on drugs. So as many drugs aren't as covered as they were. We hope that this trend will change in the next year or so and maybe kind of stabilize a little bit, but we're all kind of feeling the crunch. But as I sometimes tell folks, my Medicare coverage in some eyes may seem a little bit high for people, but before I got on Medicare, I was paying almost 4 times as much as I'm paying now for worse coverage. So I feel blessed to be where I'm at with the coverage I have. And I've had some surgeries and things done and just been real happy with the way that Medicare and my supplemental plan is taking care of me. But if you'd like to talk about Medicare supplement coverage, we'll talk to you about that. If you'd like to talk to you about, want to talk about Medicare Advantage, then we want to talk to you about that. We just want you to know supplements are a little easier to talk about and not as many bells and whistles. But what I get discouraged with sometimes, people will buy a Medicare Advantage plan and really have no idea what their costs are. Now they can tell you exactly what their free benefits are. They know those. But when it comes to individual cost, how much is the hospital stay? How much is an MRI? How much is this? They don't know because they were bought on emotion. Zero payment, free benefits. So if you come to me, and you have, many of you have, if you come to me and you want to talk Medicare Advantage, we're going to spend about an hour and 10 or 15 minutes, and we're going to go through every line item on that so that you know exactly what your costs will be. No surprises, nothing hidden. I never want you to call me the middle of the year and say to me, Keith, you didn't tell me that. That's just not the way we operate. So we're going to tell you the good, the bad, and the ugly, and we're going to let you decide which plan is best for you. So thanks for letting me share a little bit with you today. I just hope and pray that you folks are staying, here. We're here in February of 2026, and snow is still deep and it's really cold. And I'm looking for warm weather. I really am. I'm looking forward to get 75 degrees and then warm up. I don't know about you. Thanks for being with me today. God bless you folks. Stay safe. If there's anything we can do to help in any way, then don't you ever hesitate to reach out to us here and we'll be glad to help you any way we possibly